I mean, we have a great surgery team, we have a great doctors, great surgeons, but all of this just helps us to have, just to be even better, more efficient, and just to meet standards. One of the, I'm going to turn into a construction worker because I've talked to them so many times and taped things, and the electricians that are putting in our new lights had told me they come every week and then they leave, and every week and they leave, that next week they're not coming because they're working at Via Christi and KSARC, or Kansas Surgery and Recovery, because they are putting in the exact lights that we are putting in now. So that makes me feel great and wonderful that we are up such high standards that we have lights before some of Via Christi and KSARC. So that's an awesome thing.
Well, I'll tell a little story. The other day, one of the construction guys was asking, well, we want to do this and we need permission. I said, okay, you got it. He said, no, we need it from Tanya.
That's
and they got it.
Story of my life.
Heating and air system, which seems, oh, we're getting new heat and air, but it's, you know, 3 things make a surgery for non-infection. Is obviously cleaning, but airflow, humidity, and temperature. And I'll show you when we go through every room there's a humidity port, a temperature port. Your humidity has to be between 60 and 30%, if not, because the sterility of your instruments are compromised. And surgery kind of has a saying, you know, when in doubt, throw it out. So if you don't meet very specific things, and this will just make our life so much easier and just wonderful.
And not only that, you know, we have 2 problems in the surgery environment. One is we got to keep the patients at the right temperature, which is the most important thing. But the problem is sometimes they get cold when they're asleep. And so you keep it warm, and then the problem is you got your staff dressed up. Sometimes we're wearing lead aprons and we get hot. And if the surgeon or one of the nurses sweats into the wound, then you've got a major problem. So you really try to find line between being too cold and too hot. There's a really specific set of parameters you have to stay within to keep things safe. So it's not just style, it's substance.
Exactly. That's what I said. Everything that we've gotten there's a specific person, you know, reason. And then the new lights, they're LED, so they're cool. It's not a radiant heat. And we'll show you the old lights, and then we'll show you the new ones.
Now, this is a room that hasn't been altered. This is room 3. We've been using it this way for the last 20 years. Anesthesia machines have been upgraded. We've got some upgraded equipment.
Our wonderful bed.
New tables. These operating lights, we got, I think, in 1996. They weren't new then.
No.
You notice we have 2 of them on every table. You put a sterile handle on. There's a little plastic green cover that goes over top so you can move it around. You can focus them a little bit, but these lights right now are as bright as they get. So, you know, we can see pretty well. You put a light on somebody's belly, and you can see pretty well what you're doing. We can move around, but that's what we're looking at once you look at the intensity of that light. It's bright enough to operate by. I've been doing it for 20 years like that. In a minute, you'll see what we got to do stuff. You'll see the difference. So anyway, just basically the rooms are what they are. They're large enough to have generally the instruments with the scrub nurse go on that side on the big table, and we put our working stuff over there, and then people can circulate back and forth through here. And this is where we spend our day, you know.
You guys did approve the new beds for us.
Yep.
These are wonderful because
Yep.
when they're in supine position like this,
Yep.
they can hold up to 1,000 pounds.
Right.
Lithotomy, with legs up in stirrups, 500 pounds. Our old beds they were manual. You had to push them.
Yep.
These are electric. They can go in many different positions. They've just been a lifesaver to people.
Right up. You know, you can move it up, you can tilt it, right or left. And it used to be we literally had somebody had to sit there and pump the brain. We'd ask somebody to reposition when they're taking out a gallbladder. We put the patient, move the head up and move the right side up, and the nurse would have to get under the drapes at the end. Now we just have an anesthetist just do that. So it works really well.
I want to point out that you see 2 supply ducts at these small oblong supply vents.
Yep.
And when you go in the other room, you see something completely different.
Well, this is what this is all about. you'll notice it looks like there's spiders going out of the ceiling now. Before, if you notice in the other room, all of the monitors for laparoscopic and arthroscopic surgery were sitting on a box, and they were heavy monitors. This thing is not only is mobile, you can actually unhook it, take it around, move it around the room. And we've got a second one over there, which you can pick up and move around. So people on both sides of the room can have their own individual screen instead of having to have a floor console taking up space. So we've got all that stuff coming out of the ceiling. And if I can find the light switch. All right. This is an LED light. I don't even know if those are all the way up. You know, in fact, I did a case in here today, and for the first time that I can remember, I said, turn the light down. Okay, take it all the way up. All right, so if you think about the last room, and these lights are bright enough to blind you. They're LED lights, and they are incredibly bright and crisp and clean, and they're pure white lights. It's just, you know, you can see it. So we've got light to spare. The other nice thing about them is they're actually, you can, before we had to turn them onto the wall, you notice I turned the knobs. You can actually turn these up and down and turn them off. You can find the right button. Pull that off so I can see. I haven't used it enough so I can remember where stuff is. You can actually turn the light down and turn it off. And you can vary the intensity with your hand. It's a sterile cover that we put on with every case, and then it just pulled off at the end of the case. Throw it away. And that comes in every pack. So, all right, now Tanya's going to show you the real nice HD camera we've got.
As surgery progresses, even since I've been in surgery for 15 years, the trend is going to more laparoscopic surgeries. And so one of the things that we've gotten besides this is new high definition cameras, which, you know, one of the things you could use smaller ports. We use, let's say, use a 10 port, so it would be this big. Now you can use a 5 port, which is this big, which means smaller incision for the patient, faster healing time. The worse your light quality is, the bigger the scope you have to use, because you need to get enough light to the system. So, you know, a standard scope is 10 millimeters, which is about as big as my little finger. And then now you can go with a scope that's about as big as a pen and get the same quality of image because you don't, the light's brighter and you can see better. And it's not coming on because you guys are all standing here.
That's the way it always works.
Apparently it's not going to work. There you go.
Tony, do these lights last? You don't have to,
you know,
how long are they good for?
They've got, they're replaced in banks, and they're LCD lights, so they're very, very low intensity and amount of, you know, you get a lot of light for little electricity. There's not a filament in there. The older light, when I first came in, we had the old metal can lights, and they had a big bulb in the center, which you had to come through the top, and they were like a big hot bulb. Yeah. You know, like an old-fashioned, you know, street light. And then, you know, those lights are not LED lights, but they've got bulbs in them which burn out from time to time. This has got multiple banks, so, you know, you could lose, they're actually in clusters of 3. And so you can change them out if you start losing, you know, you could probably lose half of your banks and still have a very bright light. But you just pop them out. And supposedly they've got like some 20,000 hour service life per bulb or something, so theoretically you should never have to change those out.
One of the great things about this upgrade that we did is we have got 6 new high definition cameras, but we have the capacity just to turn a switch, and on smaller cases that we might do a hysteroscopy, which is looking inside the uterus, we can use our non-high definition and save all of the new equipment for laparoscopic abdominal cases.
Yep.
Which is
all right. So there's a pretty nice picture of the.
Wow.
Even though it's upside down, we'll try it over. There you go, and that's, you know, I mean, that's like a giant HD picture. We can actually make that image bigger. And when you get in the belly, you just, depending on where you're working, you can move around. But it's just, I mean, you're looking at, you can look at a 2 millimeter vessel and just have a crisp image and say, okay, I can see that point right there, and I can just slide an instrument in behind that. You can see exactly what you're doing. So, you know, it's nice, it's easy to use. It goes through a port, and you drive it around, you This is an angled scope, so you can look off to one side or the other and sneak in behind stuff. So it's just, it's the other stuff we've been using works fine, but it's kind of like you go from a regular TV to an HD TV, and all of a sudden you go like, wow, where'd that come from? So life is good, and we'll get better.